Thank you, Mr. Speaker. This amendment would restore funding for the Medicaid cuts that have been made over the last couple of years. I've heard a lot of misinformation about what is driving the costs of health care in the state of Washington. I've heard on the news as well as from the governor that the reason all of the health care costs are going up is related to H.R. 1. I didn't know if you were aware that there's actually only one provision of H.R. 1 affecting Medicaid cuts that is currently in effect, and that would be regarding abortion care, and that provision actually expires on July 4th of this year. Every other provision of it does not actually go into effect until 2026, December 31st, 2026, at the earliest. So all of these cuts that have been made have actually been self-inflicted cuts made by this body in the underlying budget proposal here or in last year's budget. If we add them up, last year, the 2025-2026 budget cut $750 million from Medicaid. The supplemental budget cuts an additional $250 million. That's $1 billion over 2 years cut to Medicaid, cut specifically from developmental disability services, long-term care, medical payments, community behavioral health services. These are all things that are critically important to our communities. A lot of these disproportionately affect our rural communities. Our hospitals are struggling. Lower reimbursements, less money going out there. This is going to increase charity care. The cuts on the underlying budget proposal are going to increase the costs of medicine for everybody in Washington. A lot of the proposals that have come out of this body last year, this year, and in previous years have increased private insurance costs. It's driven healthcare costs across the board, and every time we cut out PEB and SEB, more costs are being shifted and causing the marketplace to increase. What this would do is restore all of that underlying funding. It would allow the people of Washington to actually access these services, and it would make sure that we don't have a furthering of our healthcare deserts in rural communities. We would have more primary care at least trying to stay in practice, specifically in our rural communities. Because if we continue to cut the payments to these providers, we're just gonna see less and less of the primary care providers. Right now, one of the major reasons that our managed care managed care plans aren't working is not because it's not a well-designed plan and is a good use of money. It's because nobody will accept new patients who works in primary care because we don't have enough primary care. The supplemental budget proposal, stripping even more money out of the state Medicaid program, is not the way to have more primary care, more access to care, better services. This will just further the damage that was done last year and will perpetuate it going forward. Our healthcare system is just holding on by a thread right now in Washington, and without this budget amendment, I'm afraid it's going to break. We're going to see more hospitals close. We've already seen one. There were a couple of proposals that came through the Appropriations Committee to help save some of our hospitals who are just teetering on the edge right now. I would ask that you join me in voting yes for this amendment so we can at least give a lifeline to the people on Medicaid, to our hospitals, to our rural communities, and restore the Medicaid funding that this state has cut.
Further remarks, the good member from the 2nd District, Representative Marshall. And Representative Marshall, you have 5 minutes and 51 seconds remaining.
Thank you, Mr. Speaker. This will be brief. There is a cost shift in this underlying amendment, or in this amendment. The cost shift is stating that PEB-SEB, the insurance that many in this room benefit from, would pay slightly more. The increase would make it parallel with what commercial insurance for small business and private business pays. It's a small ask. I am willing to pay an additional percentage in my health care, which is far less. In fact, it's about 25% of what I paid when I was in the traditional commercial market. I currently pay 25% of my premiums for far better coverages and much lower deductibles. But this would ask for an increase of the people that participate in PEB-SEB to make it align with the commercial market, and it would take those dollars and it would put it back into the state's Medicaid system to those that are truly in need. So again, I would urge you join me in voting yes.